everyone, it's Dr. Tina Hahn and Crystal, and this is the next part of how to give a subcutaneous injection. So I have my cat here, Mima. She has graciously volunteered to be present for this video. So if you watched in the other video how to orient yourself on how to give, how to pull up the skin to create the tent for your sub-Q injection, watch that one first. But here, just to kind of demonstrate on her, I'm going to pull up at the base of her fur, and then it's going to create this tent, okay? This tent is right here, this little triangle. And what I'm going to aim for is I'm going to aim to give the injection right in the middle of that triangle. This works for both like insulin injections, B12 injections, other injections that your veterinarian may prescribe for your pet. This is a common area on how to give the sub-Q injection. So a little bit on needle handling. This is an insulin syringe, okay, but it could be a different type of syringe. But in this case, it's an insulin syringe. It's a very small needle. To open it, you just pull the cap off, and then it's a very, very short little needle. I don't know if you can see that. It's a very, very short little needle, and it's very, very thin, so they don't feel it at all. So part of this is going to be just getting used to holding the syringe. And I like to teach people when they give the injection to hold it. I'm not a smoker, but just pretend like you're holding it like a cigarette. So it's going to be between your index finger and your middle finger, and you're going to hold it at the base of the syringe. So the part where you can see this stopper, you're holding it right there. And I don't recommend that you place your thumb on the end of the plunger, because if you're not used to it and you're nervous and you inject with your thumb on, you might accidentally squirt the medication out before the needle is actually in. So I recommend keeping your thumb off the plunger, but sort of at the ready. So I just rest it on my index finger, and I've got full control of the syringe just by holding it here at the base with my fingers against the little plunger end, okay? What we're going to do is when I give the injection in that space, and I go all the way to the hub of the needle, so I'm going to inject, and it's going to go all the way to the end of that plastic syringe. I'm going to work on pressing the plunger towards my fingers, okay? I'm not trying to press the whole thing into the patient. I'm just trying to press the plunger to my fingers, all right? And that's going to help keep that syringe steady so that you're not like continuing the forward motion into the pet, all right? So again, with my non-dominant hand, we're going to reach for the back of the shoulders, the base of the fur. I'm going to apply gentle traction. I create this V, or this triangle, and I'm going to go right in the middle. I'm going to have the syringe parallel to the body, so I'm not going like this. I'm not going angle. I'm not going directly down. I'm trying to keep the syringe parallel to her body, and we're going to just go straight in. And once I'm in, meaning I can't push any further because the skin is against the end of the syringe, then I'm going to hit the plunger, okay? So here we go. 1, 2, 3. Traction up in the middle of the triangle, all the way in, plunge, okay? And then straight out. And she didn't feel it at all right? So that's how you give a subcutaneous injection. Just a little bit about how to recap your syringe. This is just basic needle handling. I don't ever recommend you try and like put them together like this, because I guarantee you're gonna like stab yourself accidentally. So always place the cap on a flat surface, as you can see here. And what you're gonna do is you're gonna scoop that cap up with the end of the syringe, and then you're gonna close it. All right, and then now you can dispose of it like you would dispose of sharps appropriately, okay? Thanks for watching. We're gonna do another one showing how to do sub-Q fluids in our pets, so stay tuned for that.